Today we're talking about something many caregivers need but often struggle to access: respite care. Respite care offers breaks from the caregiving role. And while asking for time away can feel difficult or even guilt-inducing, it's one of the most powerful ways to protect your health and continue showing up for the people that you love. Stay tuned and we'll get into it. Hi, Dr. Lakelyn here. Welcome to Caregiver Chats. I'm a gerontologist and caregiving advocate for Home Instead, an honor company. I'm so glad you're taking the time to join me. These conversations are a space for learning, reflection, and support, and I invite you to subscribe to Caregiver Chats on Apple, Spotify, or wherever you get your podcasts. And don't forget, I love hearing from you. You can email me anytime at caregiverchats@homeinsteadinc.com. In this episode, we're diving into some powerful new research that shines a light on the reality of caregiving in America today. The Caregiving in the U.S. 2025 report has recently been released and brings both validation and urgency to the experience of millions of family caregivers. One finding that really stood out was that nearly 4 in 10 caregivers say that respite care would be helpful, but only 13% are actually using it. That is a big gap, and one that's taking a toll on caregivers' health, stability, and quality of life. So what's getting in the way? And what can be done to help close that gap? To help us unpack the findings and explore the importance of respite support, I'm joined by Jason Resendez, President and CEO of the National Alliance for Caregiving. Jason is a leading voice in caregiving advocacy and health equity, and he brings deep expertise to this conversation. We'll talk about what respite really means, the different ways it can be accessed, and how we can better support caregivers across communities. Welcome, Jason. It's so great to have you with us today on Caregiver Chats.
Thanks so much for having me, Lakelyn. I'm so excited to share a little bit more about our work and insights and think about ways to better support this really incredible and important community.
Oh, absolutely. Well, and I am such a big fan and supporter of NAC, National Alliance for Caregiving. I'm on the board of directors, and I know Home Instead has been a long supporter of the organization and of this new Caregiving in the U.S. 2025 report, which I totally geek out over every time it's released. As a gerontologist, as somebody who's in this caregiving realm, I just love the data and insights that it provides. And I remember back to my dissertation days, I think I quoted that report, numerous times in my final dissertation. So it is a resource that gets used often, and it's really important. So first, I just want to say thank you to National Alliance for Caregiving and AARP for putting this report together and sharing it out with this community and for capturing the voice of the caregiver.
Absolutely. No, thank you. I always love hearing those stories of folks who know the data, who've used the data in so many different ways. And it certainly wouldn't be possible without your leadership and championship, without the support of Home Instead and Honor in making this work possible. I think of it as a tentpole of the caregiving community. It is a really incredible resource that NAC is really proud to help steward over the last almost 30 years and really gives our community of partners, whether that's within direct services, within the private sector, policymakers, a really important tool to help understand who family caregivers are, the challenges they face, their aspirations, and the gaps that exist in support of caregivers. And that's really critical when we talk about developing better policies, developing better services, raising visibility and awareness of the really hard work of family caregiving.
Absolutely. Absolutely. Well, and this is one of the many things that National Alliance for Caregiving does. So, Jason, before we dive into the report, would you just mind sharing a little bit more about the organization and the role that they play kind of in the caregiving ecosystem?
Absolutely. So one, thank you so much for your leadership with the National Alliance for Caregiving on our board.
My pleasure.
It's been incredible working with you and really incredible to take on this role in an organization like NAC, which, as you said, is really critical to the caregiving ecosystem. We are a national system change organization focused on transforming how we value the contributions of our nation's more than 63 million family caregivers. We do that through research, through advocacy, and through narrative change, really thinking about how do we better ensure that caregivers have the infrastructure that they need to make their work more sustainable, more equitable, more dignified. That means working and bringing partners like Home Instead alongside partners like Pfizer and Merck and the Alzheimer's Association and the American Cancer Society together around the same table, around opportunities to uplift the needs of family caregivers at a system level. I think that's one of the most challenging things about caregiving is that it is one of those issues that touches so many different parts of our lives that really requires systems better working together to recognize and support family caregivers, whether that's the financial hardships of caregiving, the healthcare hardships of caregiving, the emotional and mental health hardships of caregiving. There's so many interlocking policies, practices, and interventions that need to be in place. And so it takes organizations doing great work at the community level, providing services, but also doing work at the national level, thinking about how those systems can better work together to support, recognize, and value caregivers. And that's where NAC comes in. We've been doing this work for over 30 years. We're best known for our research. Over the last 3 years, when I came on board, we really focused on how do we better translate that research into system change, into initiatives like our nation's national strategy to support family caregivers, like policy initiatives like the Credit for Caring Act or the Lifespan Respite program to better put in place resources and supports for family caregivers. But that all comes down to really what we see as the core three areas: research, policy, and storytelling. Right? Data is critical, but data makes you credible, but stories make you memorable. So really combining the data of something like the Caregiving in the U.S. report alongside stories of family caregivers around the country to spark the change that we need at the national level.
Which is so important. And I think what's so interesting about caregiving is every family's situation is so unique and different. But there are elements of caregiving that do kind of rise to the surface. And that's what this report captures is, the commonalities, the common challenges, the gaps, as you said, in that caregiving journey and experience. And so often caregivers feel isolated in that caregiving role. So to know that there's an organization on a national level that's saying to caregivers, we see you, we want to know what you need, and we're here to advocate for you. It's incredible. So it is a true pleasure to be in support of the organization and to watch how you have really helped to transform this narrative around caregiving at the federal level that's trickled down locally. And this report, Caregiving in the U.S., is a big part of that. And I'm just curious to know, Jason, what makes this year's report different or significant? How has it kind of evolved since the last time you did this study back in 2020?
Yeah, absolutely. You hit the nail on the head, right? Sort of caregiving is something that really everyone has their own caregiving journey. But when we look at the data, we look at caregiving in the U.S., what we see as a key theme is that this is a rapidly growing community. So while caregiving journeys are unique, caregiving is a shared experience, right? It's something that connects so many of us. When I'm doing an event, my first question is, how many people in this room have been touched by caregiving, either as a caregiver or know someone who's providing ongoing, demanding care? And I'm always shocked, but never surprised by the response to that question, because it is such a common bond, and the data reveals that. One of the key things that we see in this report is that there are 63 million Americans providing ongoing, demanding care in this country. And one of the unique things about this report is that we're able to look back at how that's changed over the last decade. And so what we see is not only there's 63 million Americans providing care, That's a 45% increase since 2015. There's nearly 20 million more Americans providing care in this country than there were in 2015. So it's a big community and it's a growing community. In caregiving in the US, because we've been tracking this data over years, we're able to see shifts. And so that's, I think, a really important hallmark of the project. This year, we made some changes. We're always striving to do bigger and better, and partners like Home Instead help to make that possible. But some key ways that we've evolved the project to better serve and address the needs of family caregivers is one, we looked at for the first time how many caregivers are receiving some form of payment as part of their care journey, which is really important because one of the things that we've seen shift at the national level are how states are responding to caregiving. And a lot of states with their Medicaid programs have introduced pathways for caregivers to receive a payment when they can't access a direct care worker. As you know well, there's a direct care worker shortage in this country. So there are states that are taking innovative policy paths to help address that. And one of those is direct payment. So we see that there's nearly 11 million family caregivers who report receiving some form of payment, primarily through Medicaid consumer-directed programs. But there are a number of other state and VA programs that offer that kind of benefit. So that's a really key shift. Another is that for the first time, we'll be releasing state data. So this is not out yet. This will come out in November, but we'll be releasing state profiles of what caregiving looks like in places like Florida, Nebraska, in Michigan, in California, and help us understand what are the state level nuances of caregiving in terms of the challenges and infrastructure and policy supports in place. So that has been a really critical change. We've also introduced some new standardized measures that enable us now to harmonize our data with other major national data sets like the CDC's Healthy Days measure. So we're able to see how many family caregivers report that caregiving has limited their ability for a healthy day, for their mental health or physical health. So there's some exciting new standardized measures that will provide really rich data for policymakers and public health professionals to really start to better tackle the challenges that family caregivers face.
Those are all very exciting updates. I'm looking forward to the state-by-state data, and I think that will help kind of, again, continue to kind of drill down from this national issue, these 63 million caregivers, which is to hear that number has grown by 45%. Wow. That alone is a staggering data point. And to take that and kind of help drill it down to the local level, I think will be so insightful and helpful. And I do just so appreciate how this report also captures the challenges that caregivers are facing so that these hopefully more states can introduce more policies and supports and systems can kind of rally around this caregiving community. And I know that over time, also in the report, as I've been kind of digging through it, we've also seen that just the nature of caregiving is becoming more complex. People are taking on more kind of medical caregiving tasks. It's taking a greater toll on their mental and physical health. And so I think that those things are important to capture through the data of this report. And I think it also points to the need for those supports and resources. In terms of kind of the challenges, Jason, that family caregivers are facing, were there any kind of data points that have jumped out to you in this recent release of the report?
Yeah, absolutely. I think you alluded to some really important ones. And I think the beauty of the data is that we're able to not just point to the challenges this year, right, but to show how they've shifted over time. And one of the, I think, most important challenges that you alluded to is the intensity of care. We see that caregiving is becoming more complex, and as a result, it's becoming more intense. Nearly half of family caregivers report that they're in high intensity care situations. So that means that they are supporting multiple activities of daily living for more hours a week than they have been in the past. And so intensity is growing when it comes to caregiving. And that, when we see in our research, higher intensity caregivers are more likely to experience emotional distress, healthcare issues, financial challenges. So intensity is a really critical measure for understanding the impacts of care on American families. The other aspect that we see over time is that duration is increasing. So not only do we have more family caregivers, right? So you talked about that 45% spike in caregivers. Those caregivers are providing care for longer. The number of caregivers who report providing care for 5 years or longer has increased from about 24% in 2015 to 30% in 2025. So that's nearly 1 in 3 family caregivers who say that they've been providing care for their care partner for over 5 years. That underscores the vital importance of long-term care solutions for better services, whether that's respite, access to direct care workers, adult day, you name it, right? Those services that help to make caregiving more sustainable over long periods of time are becoming more critical because we see more family caregivers providing care for longer. We see more caregivers helping with 3 or more instrumental activities of daily living than before. So that's helping with kind of complex tasks like managing finances and medical care. More families are providing that high level of intensive care today than they were in 2015. So that's an important trend that we see. One of the key trends that we see that is something that remains stable, but I think really important to call out, is the number of family caregivers who are providing care while working. Around 60% of family caregivers are juggling both caregiving and workplace responsibilities. And so that underscores the importance of employer-based supports. And I'm sure we'll talk about this later, but that is one of the bright spots of the report, is that not only are caregivers balancing that, but more employers are starting to step up and recognize the importance of supporting their employees who are providing care. So we've seen an increase in the availability of workplace benefits, like flex time and caregiver benefits, whether that's concierge, coaching, you name it. More employers are starting to offer caregiver-related specific benefits. And then related to that, more states are passing paid family and medical leave laws. And so more caregivers than ever. We saw a 56% increase in the number of caregivers who report access to paid family and medical leave in 2025 compared to 2015. So there have been some really important challenges that have emerged over time, but also we've seen some positive shifts that emerged over time. And then the last thing I'll say that has remained consistent, that I think speaks to the resiliency and the strength of family caregivers, is despite all those challenges, we still see that over half of family caregivers report a deep sense of purpose with their care. And so, challenges are certainly still present, but meaning making is really a hallmark of the caregiving journey. But I think it's important to recognize that caregivers cannot live on purpose alone. We need to have more supports in place. But it is really heartening to see that sense of resiliency really come through in the data. And more than anything, I think what this data reveals is that these are ordinary Americans providing extraordinary care despite the challenges that come through loud and clear in the data.
Oh, Jason, I'm so glad you brought up that last point on that sense of meaning and purpose, because I did want to make sure that we talked about that as well, because there are so many challenges, but there can be this kind of beautiful side to caregiving that many experience. Not all. So I do want to recognize that. Not all maybe have that feeling of meaning and purpose, but it is an important part of the journey for so many. And so thank you for giving us that kind of overview and recap. And I know, when we talk about supports for family caregivers and making sure that we're setting them up, to hopefully prevent that point of burnout, or for those caregivers that are in it for the long haul, are providing care for over 5 years, that we're giving them resources and support, breaks from their caregiving role so that they can continue on to provide such needed support. And so you asked some very specific questions in the report about respite care. And respite, just to give everyone just a definition of the term, if you're not familiar, is really a short break from caregiving. And that can look different. It can come in different forms. But in the research, nearly 4 in 10 caregivers said that respite would be helpful. But what I thought was so interesting is only 13% were using it. And so I think that maybe if we could just spend a little bit of time maybe unpacking that data point, providing some resources and some supports that caregivers can turn to. So hopefully in the next iteration, we'll see that utilization rate increase, because those short breaks can really help to sustain a caregiver in their journey of caregiving.
Yeah, absolutely. I think this is a really important finding because it continues to speak to how important respite could be for caregivers who are providing complex care over longer periods of time. Really, it's, I think, a really critical tool for sustaining the work of care. I think that's how I really think about this work. And, you and I go way back, and I come from the Alzheimer's community where we're working to cure Alzheimer's disease. That's not the case with caregiving. We're never going to cure caregiving. Yeah. Caregiving is always going to be a part of our lives, our families. It's about how do we make it less hard? How do we make it more sustainable? How do we reduce the impacts on the caregiver, the negative impacts of the caregiver providing that care? And respite is a really, I think, important tool in that toolbox of making caregiving more sustainable. But there are so many barriers to respite. I think one is like awareness of like, what is respite, exactly. Right? There's, I think one of the things I talk to respite advocates about is the need to rebrand respite, like help folks understand what is respite. And it does come in so many forms, like adult day services. I know you mentioned that. I think that's a beautiful example of what respite could look like. I grew up in a small town in South Texas, and we didn't have a lot of resources for caregiving, but there were a number of adult day centers, right? And understanding what the role they can play in helping to make care more sustainable, I think is really important. We've seen really innovative respite models that really look at expanding the perception of what respite is in places like Michigan, where there are programs that do a theater takeover. And respite is taking your loved one living with cognitive decline to a movie theater in a way that, is tailored to their cognitive needs, and gives a caregiver, a chance to maybe take a break because they're with a larger community and there's care provided, but also to be able to go to the movies with their care partner. That's a form of respite. We've also seen something similar with cruise ships, right? There's just a number of different ways that respite can manifest in communities and in people's lives. But there's so many barriers beyond just understanding. Sort of being able to have access to those kinds of resources is really critical. So when we think about key barriers to respite, I think there are a number of opportunities for policy change to help address. One of these is like financial barriers, right? A lot of insurance plans, Medicare, Medicaid don't cover respite care services, right? So it's really thinking about how do you start to not only have access, but have affordable access to respite. And we're starting to see more states step up. You have great examples like Maine who've introduced stipend programs, or one of the things that you can pay for with that stipend is respite care. So starting to try to address some of these financial barriers. We see some Medicare Advantage plans offering respite. You have something called the guide model within dementia that is revolutionizing how we provide dementia care in this country. And a hallmark of the guide model, this really innovative payment model, is that it's integrating the caregiver and paying for things like respite care. So there is opportunities, I think, to think about ways that policy can overcome these financial barriers. But I also think there's because of, these existing financial barriers, because of even in some cases, the lack of providers around respite, there are wait lists and limited availability of respite, which create issues with access, particularly in rural communities. That's one of the things that we found in our data is that family caregivers in rural settings report it harder to find affordable services or caregiving services more generally, including respite. And that speaks to, things like geographic barriers. And then there's also, the fact that respite is not going to be the best fit for all caregivers. You mentioned earlier, I think something really important to remember about caregiving is, while it connects 63 million of us, each caregiving journey is unique. And while respite might make sense for a family caregiver in one situation, it might not make sense for a family caregiver in another situation. We've heard stories from caregivers, particularly of caregivers of people living with dementia, where, respite might not be the best resource because of the, impact that it might have on the care recipient in terms of routine and changing that routine and getting back to baseline, and how respite or any kind of other, change to a routine can kind of set back that baseline. So it's really important to know that it might not be the best fit for all caregivers, but all caregivers should have the choice of finding that out and access to services like respite to help make their journey a little less hard and more sustainable.
Absolutely. Well, I'm glad that you addressed some of those barriers. And I think too, just the very first one you mentioned is just knowing what the term is, what it means, and starting to look into it before you think you even need it. I think another barrier is a lot of times caregivers say, well, things aren't bad enough yet. I don't need it yet. And so they kind of delay it. And I like to encourage caregivers to just reorient their thinking around that and start to integrate it a little at a time before you think you even need it. Because when a crisis happens or you get to that burnout point, as you mentioned, there might be wait lists, or you might just be overwhelmed by the research or the time it takes to get into a program or to start an in-home service. And so, integrating it into your caregiving journey early, if it's an option for you, could be beneficial in the long run, and just getting you and your care partner used to having that respite built in, whether it's going to an adult day center or having somebody come into the home, or another form that is maybe a little more rare but is available in some scenarios is a short-term stay in a community too. So if a caregiver themselves has a health issue or a scheduled surgery, or needs to go out of town for a funeral, or wants to take a vacation, those kinds of short-term stays in a community setting might also be available, but takes a little bit of time and research. So if you're listening and you're thinking, oh, this respite care kind of sounds interesting, I would encourage everyone to start looking into this type of service. And we're going to provide a lot of links in the show notes. I know Jason has mentioned a couple of these resources already. And one that you mentioned earlier on, but didn't touch on just now is the Lifespan Respite Program. And so, Jason, if you have any more thoughts that you wanted to share around that, I think that's a great place for families to start to look into respite care, what it means, and what might be available locally.
Yeah, absolutely. I think the Lifespan Respite Program is really critical in states across America and providing and helping folks navigate, respite and what makes sense for them and their families, and local area agencies on aging. So looking up your local area agency on aging is such a really critical first step in a lot of cases, because you'll find information about what respite services and what respite providers and what lifespan respite resources are available to you in your state. One of the most beautiful things about the Family Caregiver Support Program and Older Americans Act supported programs and related programs like the respite program is how expansive they are in terms of who qualifies for those programs. So I think that's a really great start. At the same time, we know there's limitations. I think one of the great things about our data, one of the important things about our data that we saw is there are over 4 million people under the age of 18 that are part of care teams in America. These are middle schoolers, these are elementary students, these are high schoolers who are part of care teams. I think about my family's journey. There were parts of my life where my grandmother lived with us, and we made sure that she was okay. And when it comes to like cooking and mobility issues, and so we were part of that care team, and I didn't know it then. Thankfully, our care wasn't, super intensive, but we know that's not the case for millions of Americans. And one of the things that we've been advocating for alongside partners like the Arch Respite Coalition is expanding eligibility for the Lifespan Respite Program to include caregivers under the age of 18. And actually, legislation was introduced that did just that, and we're hoping that it gets passed. So it's such a great program, and it's a program that more Americans deserve more access to, including younger caregivers.
Oh, gosh. Yeah. I think youth caregivers could be a topic for a whole nother podcast,
Absolutely.
Just the challenges that they face. But I think, it just speaks to caregiving is a life course issue. Not only could a care recipient need a caregiver at any point in the life course, but also various points in our lives throughout our life course, we're likely to be caregivers. Maybe it's in our youth supporting our parents who are supporting our grandparents, or we get to maybe our kind of middle age and we're supporting our aging parent or relative. And so it can hit you at various points. And I'm also glad earlier, Jason, you brought up working family caregivers, because we're seeing so many more people in the workplace trying to juggle that caregiving role while maintaining their income. And it is encouraging to see that employers are recognizing the needs of their caregiving workforce in their workplace. And so offering things like EAP program support, or even just tapping into your existing EAP resources like the mental health resources that you might not have thought as a caregiver would be beneficial, but really could go a long way in supporting you. So any other innovative things you're seeing workplaces do to provide support or resources to their employees?
Yeah, absolutely. I think you hit the nail on the head. So really thinking about, first and foremost, understanding and being intentional about understanding that, hey, my employees are caregivers, right? There is like a Venn diagram that we need to think about. And then thinking about what can I do to better support these employees? Because one of the things that we see loud and clear in the data is that not only are 60% of caregivers working while caring, they're experiencing workforce disruptions because of those caregiving responsibilities. Yeah. They're coming in late. They're adjusting schedules. They're passing up promotion opportunities. They're passing up advancement, which is detrimental to the caregiver, but it's also detrimental to the employer, right? We want better leaders and star employees to advance within our companies and within the private sector. And so when caregiving becomes a barrier to that, that does a disservice on a number of levels. And so there are tremendous workplace disruptions that happen, not because of caregiving, but because of a lack of support around caregiving, right? And I think that's where employers are starting to recognize and innovate to address those barriers. And you mentioned a few really good ones. And I think one of the innovative things within that is not just thinking about a caregiver coaching benefit, but thinking about exactly what are the benefits that I already offer that need to be connected to and wrapped around my employee who's experiencing caregiving challenges, whether that's mental health support, whether that's transportation support, whether that's flex time. I mean, really thinking about this from a whole person perspective. And certainly caregiving specific benefits are an important aspect of that, which we've seen a lot of companies step up and provide support through companies that actually we work with at NAC through our membership program like Clio and CareLoop, who provide navigation services for employees around things like finding someone who knows how to provide complex care, for my child, or maybe it's a referral to a respite program in my community. There are a number of caregiving coaching companies that help to make those connections, but also better understanding what nutrition assistance, can be helpful here, what mental health, what physical, health benefits might be relevant here, I think is really critical. And we're starting to see more employers step up and do that kind of data analysis and sharing. We had this really great conversation recently with our partner Clio, who is working with one of our other partners, who's a large healthcare company. And they were comparing data to see how many of my Clio employees who utilize Clio are also utilizing or underutilizing other benefits like mental health support. And then thinking about ways to better promote access to those benefits, knowing that there was a common journey when it comes to mental health support and mental health impacts in caregiving. So that kind of really innovative, I'm going to identify caregiving as a key issue. I'm going to identify the number of my employees who are providing care, and then purposefully thinking about how to better service that population, I think is one of the most important things that employers can do to start better valuing and telling caregivers that, hey, we see you. I know that you're providing care, even if you're not telling me. I think that's the other piece that came through in the data is there's a large number of family caregivers who are providing care, but don't tell their managers about it because there are no resources or they're scared of being retaliated, discriminated against in the workplace because of their care responsibility. So it's really critical for employers to step up. And not just provide support, but create a culture of care within the workplace. And I see more and more employers starting to do that, having C-suite executive, having managers talk about their care experience. And you think about paid family and medical leave. It's great if you live in California and have access to paid family and medical leave. But if you have a culture within your company of not utilizing that benefit, then it doesn't do anybody any good. So having managers help to promote a culture of care really goes a long way to meet benefits and make sure that they're utilized.
Thank you so much for giving us some insights into that specific kind of group of caregivers, those that are working. And it is really encouraging to see employers step up and even things as little as lunch and learns on topics, inviting your local area agency on aging in to speak and on caregiving resources. I mean, even those little things, connecting caregivers to resources is so powerful. And what I think, I was having an interesting conversation with the fellow gerontologist, and we were talking about how, the workplace and HR departments have a unique opportunity because they are usually feeding their employees a lot of information about a lot of things. So if they can, pass along those caregiving resources and meet their employees where they're at, that could be just a powerful way to just get the word respite out there or that education out there. So if you're an employer or in an HR department listening, reach out to me, any of our home insteads, any of your area agencies on aging, and bring someone in as a guest speaker. That could be just a first step in supporting your working family.
I love that idea. I love that. Inviting a local area agency on aging rep. They don't get enough love in this country. And I think they would love to be invited to a lunch and learn. There's actually an episode of The Pit, which is this great show on HBO. And one of the things that really impressed me about The Pit is there's a episode where they're talking to a caregiver, and they are referring that caregiver to a local area agency on aging. And it was the first time I'd ever heard that term on a national television show. And so I think there's a shift happening, and employers can be part of that shift in spotlighting these local resources and national resources. And I guarantee you, your local area agency on aging representative would just be over the moon to help connect those dots in your community and with your employees.
Absolutely. I know it is interesting to see how caregiving has worked its way into mainstream media because everyone is being touched by it. And I think it goes back to that very first stat that you shared, Jason, of a 45% increase over the last decade of people caring. And it's just becoming part of the lived experience for the majority of Americans. So I think we'll continue to see it be represented in media, mainstream media, and hopefully continue with great organizations like yours at the helm, Jason, to advocate on a federal level for these supports that are so important. So real quick, I do want to recap for everyone that if you don't know about Respite yet, it really is just that short break from caregiving. It can come in so many forms. And so start to do your research now. Reach out to your local area agency on aging. Look into the respite programs that might be available. And it can take many forms. It can be adult day. It can be an in-home care provider like a home instead or others. It could even be just a family member or friend coming over to give you a break. Or it can be kind of in those more formal care settings too. So start to do your research and not be afraid to ask for help or to take that time away for yourself. Those short breaks to reset and recharge, because hopefully if we see more caregivers, Jason, using these kinds of resources, then hopefully those statistics around the emotional toll, the physical toll, we'll start to see, the impact in a positive way on those statistics in the coming years. So I just wanted to just plug that one more time before we kind of wrap up our conversation. And then Jason, from your perspective, would love for you to just share one last kind of takeaway or thought on this topic with our listeners today.
Yeah, I think for me, I'm just so grateful for you sharing this platform, because I do think one of the heartening takeaways from this data, from this report, is that we are seeing systems start to catch up to the reality of caregiving in this country. Whether that's employers, we're seeing more technology utilization, we're seeing more caregivers start to do things like financial planning, and there's a lot of more intentionality around care and supporting family caregivers. But it's not keeping up with the pace of demand, with the pace of the number of family caregivers in need of support. And that, I think, was where there's an opportunity, right? There is opportunity when there's such a tremendous community that's connected by a singular issue, to come together and to continue to raise the visibility, share stories. I think this data is really critical. Like I said, data makes you credible, but stories make you memorable. So being able to share your stories around caregiving, I think, is absolutely critical to start to address some of these challenges and these gaps. And then I think, like you said, Lakelyn, ask for help. Don't be afraid of asking for help. I think this is something I saw with my mom, who is a sandwich caregiver, never asked for help. And I think that's a cultural thing, but I also think it's a lot of compounding issues there. But it's so critical to help to make caregiving more sustainable, right? You have to ask for help. And then if you're listening and you're not a caregiver, but know of a caregiver, give help. Don't ask, what do you need? Just show up. Whether that's a text, a call, be that respite for somebody in your life. It takes, just one small act that can help to contribute to make caregiving more sustainable in this country. And we all have a role to play in that. And this data underscores that loud and clear.
Oh, Jason, what a great way to wrap up our conversation. And I would encourage people to visit NAC/NAC's website and plug in, tell your story. They have great ways to engage in this advocacy effort and movement, and most importantly, to share your stories. And so, as you mentioned, Jason, people remember the stories. And so grateful that you're here sharing with us, and excited to see how this research continues to educate and inform and increase and amplify the advocacy for this important group of 63 million Americans who are providing care. So, Jason, thank you so much for being with me today and for sharing.
Thank you so much for having me, for your leadership, and for all the work that Home Instead is doing to address so many of the challenges that we talked about today.
A heartfelt thank you to Jason Resendez for joining me today and sharing such important insights. The Caregiving in the U.S. 2025 report gives a voice to the real experience of family caregivers. And it reminds us that support like respite care isn't optional, it's essential. To all of our listeners, I hope today's conversation offered encouragement and ideas for how to find these much needed moments of rest. If you're caring for a loved one, please remember, taking care of yourself is part of taking care of them. If this episode resonates with you, please subscribe, leave a review, and share it with someone who might benefit. And I'd love to hear your thoughts on topic ideas. Just email me at caregiverchats@homeinsteadinc.com. Thanks for listening, and please remember to take good care of yourself while you care for others. Caregiver Chats is brought to you by Home Instead. If you're looking for in-home care to support you on your caregiving journey, please visit homeinstead.com to learn more.